Assalamu alaikum. Now, it's a time for Zollinger Ellison syndrome. Zollinger Ellison syndrome, the epidemiology of Zollinger Ellison syndrome, age group is 20 to 50 and 80% sporadic and 20% men 1. In men 1, there is pituitary, pancreas, and parathyroid. In clinical feature, there is multiple refractory peptic ulcer an ulcer distal to the duodenum, and there is chronic diarrhea. If you do serum gastrin level, it is more than 1000. So serum gastrin level more than 1000 in the presence of normal gastric pH, like pH less than 4. Workup is endoscopy, CT scan or MRI, and somatostatin receptor scantography for tumor localization. So for tumor localization, we need to do somatostatin receptor scintography. Why can Zollinger Ellison syndrome present with diarrhea and steatorrhea? Because there is increased gastric acid and decreased pH, increased gastric acid secretion and decreases pH of the intestinal contents, inactivating pancreatic enzyme, interferes with the emulsification of fat by the bile acid and damages the epithelial cell and villi, and thus causing these malabsorption. So in Zollinger Ellison syndrome, there is increased gastric acid secretion, which decreases the pH of the intestinal content and inactivating the pancreatic enzyme, which interferes with the emulsification of the fat by bile acid and damages the epithelial cells, villi, and malabsorption. If there is suspected gastrinoma, endoscopy shows multiple stomach ulcer and thickened gastric fold. Endoscopy shows multiple gastric ulcer and thickened gastric fold. If check serum gastrin level of PPI for 1 week. So you have to shut off or you have to stop the PPI for a week. Then you need to do the gastrin level. If it is less than 100, no gastrinoma. If it is more than 1000, check gastric pH. Check gastric pH of PPI of for a week. If pH is more than 4, no gastrinoma. If pH is less than 4, further testing to localize the gastrinoma. We need to do further testing to localize the gastrinoma, and in for that we need to do CT scan or MRI or somatostatin receptor scintography. After doing serum gastrin level, if serum gastrin level is confusing like 110 to below 1000, within 1000, then you need to do secretin stimulation test. If secretin stimulation test is positive, go for further testing to localize the gastrinoma. So first suspicion, then do gastrin level after PPI off for a week. If it is more than 1000, then it is more probably gastrinoma. Then you should check the gastric pH. If gastric pH is more than 4, no gastrinoma. If gastric pH is less or equal 4, then you need to do the further test for localization. An ulcer distal to the duodenum in the jejunum suggests excess gastric acid that cannot be fully neutralized in the duodenum. Ulcer distal to the duodenum or in jejunum suggests excess gastric acid that cannot fully neutralize the duodenum. Okay, that is all about Zollinger Ellison syndrome. Hope you enjoyed.